Alright, let's dive in. Today we're tackling India's healthcare system. Huge topic, definitely complex. We're talking over 1.4 billion people.
Well, more than all of Europe. Imagine trying to provide healthcare for that many.
It's a massive challenge for sure, especially the differences between urban and rural areas. Yeah, huge disparity.
And to understand all of this, we've got a ton of research reports, economic analyses, on-the-ground accounts to rate from healthcare workers themselves.
So we'll be looking at government schemes trying to bridge that gap, and see what's working, what's not, the impact on the nation's health. What's jumping out at you so far?
Well, you gotta start with the Ayushman Bharat, right? That PMJ program.
The big one. It's the world's largest health insurance scheme. 500 million people they're aiming to cover for hospitalization. Huge undertaking.
It's been called a game changer.
And it is. I mean, that financial protection, it's a huge step toward universal healthcare.
Absolutely, but are there hiccups? There's gotta be.
Yeah, definitely.
But hospital participation, right? It's uneven across the country. In a big city, you might have lots of hospitals in the network.
But rural areas could be a nearby, so access is still a major issue, which keeps coming up in our research.
What else targets those underserved areas?
Well, there's the National Health Mission, the NHM.
Okay, familiar with that one. It focuses on infrastructure building, clinics, upgrading facilities, training workers, all that, particularly in rural areas. They've had some wins, haven't they?
For sure.
Yeah, institutional deliveries have increased, which is great for maternal and child health.
Good news.
But there must be roadblocks too, right? Nothing's perfect.
True.
Exactly. You can build a fancy hospital, but without staff, it's just a building pretty much. S1, media group, Indian nurses working, medical technicians using equipment, healthcare workers in hospital at stock, at distribute _equally. It's more than that. Nurses, technicians, whole support system. Narrator, media group, Indian doctors in a meeting, healthcare professionals in a hospital ward, busy hospital staff in India, at stock, at distribute _equally. Staffing is the biggest one. Not enough doctors. So it's clear these schemes aren't just about money, right? They're reshaping how healthcare is delivered.
Totally. The National Health Mission, for example, is standardizing maternal and child health services.
And you get more uniform.
Yeah, and the Pradhan Mantri Jan Arogya Yojana, by bringing in private hospitals, it's changing the whole market dynamic.
It is. It's fascinating to see how this plays out in reality.
Speaking of which, we have these two states, right? Kerala and Bihar are the comparison striking. Kerala's strong public health system has always been a leader. They've nailed the NHM implementation. Well-staffed clinics, even in remote areas, are the model.
Yeah, while Bihar they've struggled, showing that even with good intentions, local governance is key.
Implementation capacity matters absolutely.
But now let's hear from the front lines. We got Munish Sharma, an ASHA worker, right? Yes, Rajasthan. Her story is powerful. ASHA stands for Accredited Social Health Activist, and they're the first point of contact for healthcare in many rural communities, a vital link for them.
Totally.
Media talk about families avoiding hospitals due to cost makes sense, but with PMJA cards they can finally seek treatment. That must be such a relief.
Huge. But there's a lack of awareness about eligibility.
And worse, she's seen hospitals turning patients away claiming no beds even though they're in the PMJ network.
So the program's there, but accessing it is a whole other battle.
While it all comes back to accountability, doesn't it?
Big time.
How do we make sure these schemes reach those who need the most?
Stronger regulations are needed, and technology could help with that. There is this push for digital platforms like those ABA health IDs.
Exactly, I use one for a health account, having everyone's record unified.
Recurring transparency for sure. Tracking claims, spotting potential fraud, making it harder to deny care unjustly.
Huge potential there, though rolling it out nationwide is a beast.
Makes you wonder, are we too focused on hospitals? What about preventing illness in the first place?
Such an important point, and the data backs it up. How so?
70% of India's disease burden is preventable according to our sources.
70%, that's massive.
It is.
Think about maternal and child health, where careless excelled, right?
Exactly. Prenatal care, skilled birth attendants, emergency care. Those things, even in remote areas, they've got it down.
Makes you realize it's not just about buildings, it's about the whole system of care, right?
What about other preventable stuff? Infectious diseases like TB and malaria, the ones in India.
Simple things can help advance clean water, early treatment, basic stuff.
But it makes a huge difference addressing those fundamental needs.
Pres up resources for other exactly. It's a holistic view of health more than just hospitals, right?
It is about creating an environment where people can actually be healthy.
How can they contribute to a healthier India? So what can our listener do?
The more people know, the more they can demand accountability. Yeah, like PMJ, their rights. Tell people about the scheme. Spreading awareness is huge.
Exactly, and advocate for change both locally and nationally.
Support organizations working on this. So it's a collective effort that has to be.
Small actions mattering absolutely. Every bit counts in building a healthier future for India.
Well said. This has been incredibly insightful. Stick around for part 2 of our deep dive. We'll keep exploring the challenges and opportunities facing India's healthcare system. We're back, diving deeper into India's healthcare. Part 2, focusing on specific challenges and opportunities.
Yeah, it's easy to get overwhelmed by the scale of it all.
Definitely. But remember, each challenge is a chance for improvement.
India's got a good track record of innovation, especially in healthcare for sure. Like, look at telemedicine. It's exploding, bringing expertise to rural areas, bridging that gap.
Though tech alone isn't enough, right? It's got to be part of a bigger strategy.
And that's where, remember the ASHA workers from part 1? These incredible women. ASHA stands for Accredited Social Health Activist. They're often the first point of contact for healthcare in those communities, the front line.
Exactly, connecting people to the care they need. Our sources say investing more in them could make a huge difference.
What kind of investment? More training, better equipment, a steady supply of medicines, empowering them even more makes sense.
Recognizing their value to absolutely their educators, counselors, advocates, all rolled into one. Scene 6, Civil Society's Role.
And speaking of advocates, civil society plays a role too, right?
Big time. NGOs, patient groups, community organizations keeping the government accountable, raising awareness, pushing for policy changes.
They see the problems firsthand that often pioneer solutions. Scene 7, Healthcare Models.
Like they're experimenting with new healthcare models, especially in rural areas such as give us some examples. Mobile clinics bringing care directly to villages, community health centers offering a range of services, outreach programs targeting specific needs.
It's a reminder that it's not just the government's job, right? It takes everyone, a collective effort.
Which brings us to the money question. Yes, financing is a big one.
Healthcare is pricey everywhere.
But in a country as vast as India, the challenges multiply. It's a developing country, growing population, healthcare needs are escalating.
But resources are limited for sure. Our sources point out that India spends a way lower percentage of its gross domestic product on healthcare compared to other nations. And that has consequences, right?
Definitely.
Tough decisions about where the money goes. Essential services like primary care, they often get neglected.
Yeah, prevention doesn't always have flashy results.
But the long-term benefits are huge, absolutely.
Our sources suggest India needs to up its spending significantly to achieve universal coverage.
But it's not just about throwing money at the problem, is it?
Exactly, you got it. We need to make sure those funds are used well.
Which brings us back to corruption. Yeah, still a major issue plaguing the system. It's deeply rooted. How do we even begin to tackle that?
Transparency, accountability.
That's where technology comes in again, like platforms that track where the money goes.
Exactly. Imagine every rupee allocated to healthcare digitally tracked from the government to a local clinic.
That would make it way harder to skim off the top.
Huge investment though, tech-wise, but worth it if it cuts down corruption.
Percent hesitation. Yeah, more resources for essential services builds trust in the system. Make sure the money reaches those who need it, that's the goal.
A responsive system.
But even with more money, less corruption, there's still the human resources problem, the elephant in the room. Shortage of healthcare professionals, especially in rural areas.
It's a tough one to crack.
Multifaceted for sure. Not enough training facilities, lack of incentives to work in remote areas. Those who do are overworked, underpaid, vicious cycle.
It is. Our sources suggest multiple approaches. More investment in training recruitment, focus on rural areas, better working conditions, competitive salaries.
In this thing called task shifting.
Task shifting, haven't heard of that.
3 other healthcare workers like nurses to do some tasks usually done by doctors to ease the burden exactly and reach more people where doctors are scarce.
Makes sense, especially when resources are tight. And remember, it's not just doctors and nurses, lab techs, pharmacists, community health workers, the whole ecosystem.
Exactly, they often work so hard with little recognition.
So, wrapping up this part, got it. The knowledge of the huge challenges India faces can feel daunting.
It can.
But there are so many dedicated people and organizations working to make things better.
There's hope, real hope.
Determination, you can feel it. Things are changing. India is on the verge of a healthcare transformation.
And in part 3, we'll explore those trends and innovations shaping the future.
Can't wait.
We'll be back shortly for the final part of our deep dive. Back for the final stretch, part 3 of our deep dive into India's healthcare.
We've talked about the challenges. Now let's look ahead to the future. It feels like there's a lot of potential there.
Sense of optimism.
Oh, absolutely.
And a lot of that comes from technology. We touched on telemedicine and augmented reality, but it goes way beyond that. Our sources point to mobile health apps, wearables tracking your vitals. Even personalized genetic testing is becoming more accessible.
So much data is putting more power in people's hands. Exactly, people can manage their own health better.
And it makes healthcare more efficient and effective, you know? Can you give us a glimpse of what this future might look like?
Imagine your medical records are accessible to any doctor or hospital pharmacy you go to. No more carrying files around, streamlined.
Exactly.
You can consult specialists from anywhere, no matter where you live, breaking down those geographical barriers.
Huge for a country like India.
And AI could help diagnose diseases earlier and more accurately. Sounds futuristic, right?
It's closer than you think.
Yeah, but we got a rubber tech isn't everything, right? We talked about the social determinants of health, poverty, malnutrition, lack of clean water. Those impact health outcomes just as much.
Absolutely.
It's about creating a society where everyone has a chance to be healthy, not just those who can afford it.
Exactly.
That's where the government's role is crucial, right?
For sure. Investing in public health infrastructure, education policies that promote healthy living, all essential.
But it's not just on the government, is it? No way. It takes collaboration. Public and private sectors, different levels of government, healthcare providers working with communities.
Everyone pitching in, exactly. We need a shared vision for a healthier India.
What trends are you seeing that give you hope?
Well, that movement towards universal health coverage feels promising. Definitely, schemes like PMJ, despite the issues, they're a big step in the right direction.
Making sure everyone has access to good quality, affordable care. That's the goal.
And we're seeing more investment in primary care and prevention, focusing on keeping people healthy, not just treating them when they're sick. It's a shift in mindset, slow, but it's happening. I'm really optimistic that India is moving towards a future where everyone has the healthcare they deserve.
And that brings our deep dive to an end. We've explored the complexities, the challenges, the potential for changing India's healthcare system. It's a fascinating, ever-evolving landscape. I feel like I've learned so much, inspired by those working towards a healthier India.
What are some key takeaways you'd like our listeners to remember?
Well, don't underestimate your own power. Even small actions can make a difference. Talk about these issues, support organizations doing good work, stay informed, stay engaged.
Because the future of healthcare in India relies on all of us.
It truly does.
Thanks for joining us on this deep dive. Keep exploring, keep questioning, and let's all work towards a healthier future for India.